Today's webinar will cover how to help consumers complete documentation requirements related to enrollment in the marketplace, including both how to prevent data matching issues from occurring when possible and how to resolve them when they do occur. Today's presenters here at the Center on Budget and Policy Priorities are Tara Straw, Senior Policy Analyst, and Shelby Gonzales, Director of Immigration Policy. With that, I'll turn it over to Tara.
Actually, am I jumping in first, Tara?
Apologies, yep. Shelby, you're first. Thank you.
Great. Thank you, Ina. Thank you all so much for joining us in this webinar today and for the amazing work that you all do to help people enroll in marketplace coverage in Medicaid and CHIP. So I'm going to kick us off with talking at kind of a high level about what the general way that the steps that happen in the process that occur for individuals who are applying for coverage in the marketplace. There will be times during this presentation where I'll refer to some specific questions that are in the application. In those cases, we're looking at the healthcare.gov questions, at least as they were the last time we saw them. That can change. But in general, when we talk about the process and how information sharing occurs and the type of documentation that's acceptable to prove eligibility factors, that should be consistent on whether you're coming in through healthcare.gov, whether you're coming in through Medicaid or CHIP, or through a state-based marketplace. So with that, I'm going to kick it off by just indicating that when people go through the application process, they provide a lot of information about their circumstances. And some of that information, especially when it's tied to being an eligibility factor, has to also be verified in one way or the other. And some of those items it's okay for the individual to just make the statement. In fact, the individual who's completing the application at the end of the application needs to make an attestation saying that everything that they've provided in this application, all the information about themselves and their families that's relevant, it is truthful. And there's consequences for not providing truthful information. So a lot of information is accepted just by self-attestation. And oftentimes an example of that is state residency. So for the marketplace, you have to live in the state that you're purchasing a health plan from, for example. And in Medicaid, certainly you have to live in the state. Oftentimes the state or the marketplaces do not ask for any evidence of that other than just here, insert your address here. So they accept that as that attestation without further verifying it. Other factors must be verified, and there is a requirement to first verify these items, to at least try to verify them electronically before you take the next step of asking the individual to provide paper documents to prove their circumstances. So that includes things like income and citizenship and immigration status. And the way that it is supposed to work is that the individual puts in all this information about him or herself, plus their family unit, and then that information, to the extent it's relevant for making an eligibility determination, is then used to bounce off of information that exists in lots of trusted government sources of information, and in some cases, some non-governmental sources. As you can see, we have the work number there. That's a non-governmental source of data, but under a strict contract about how to utilize the information. So that is generally what will happen, is that the first line of defense, or the first action that will occur, is that information provided in the application will be then utilized check against information on trusted data sources. And sometimes this works, and when it does work, it's great, right? You sail through the application and you do not have to provide additional evidence about your circumstances. And we can all agree that that is a good day when that happens. But that doesn't always happen. And there's a variety of reasons that that could not happen. And some of those might be because there simply is not enough information that allows for this kind of data exchange to happen either. It could be because some situations have changed, right? Maybe an applicant, for example, has not filed taxes in the past year, so then their information is not available in the IRS data, verification process that is in existence. Or maybe an individual came to the U.S. And when they got their Social Security card, they were a lawful permanent resident, and now later on have become a U.S. born citizen. Well, Social Security Administration can't, in some cases like that one, they know that they were able to substantiate whatever the immigration status was at that point in time when that person got their Social Security number, but they don't know. They don't get involved in this whole naturalization process when somebody's changed their circumstances. So there's some inherent limitations in the data sources that would make it so that the information is not going to be able to be electronically verified. In other cases, people's situations have changed. Maybe they got divorced and, their household looks very different, or they got a new job and their income looks very different, or they're working a lot more hours than past years. So in those cases, the information is not is not matching up closely enough for the system to say, yep, we can verify through our electronic information that this person, that the information that we're going to be utilizing to make an eligibility determination is reasonably compatible with information that we have available in these data sources. So when this data matching cannot occur, which happens for a variety of reasons. Obviously, it does not mean that this person is not telling the truth. It just means, like I said, there might be some system limitations or database limitations. There might be some human error that can occur. Maybe you make the wrong attestation, or maybe you changed your name. All sorts of things could happen, right? Or your circumstances have changed significantly. When that happens, a data matching issue has now occurred, and we refer to that as a DMI. And that means that now the individual is going to be asked to provide evidence about their circumstances. And in general, when this happens, the marketplace will say, we're going to take you at your word, for a short amount of time, either 90 or 95 days, depending on what kind of data matching issue has occurred. And during that time, we need you as the applicant to provide us that evidence that we're going to be asking for. But in the meantime, we can award you the ability to go ahead and purchase a marketplace plan. And in most cases, we will also award an advanced premium tax credit based off of your attestation, as well as cost sharing reductions when applicable, and while all of this gets resolved, right? So that happens oftentimes. And, the consumer will experience this and see this in a couple of ways. The first being, right on, I was going to say camera, because now we're always on camera these days, but right on screen. They will get a notice that kind of gives them a red flag that, your eligibility is temporary and you have by X date to provide this evidence that, will be further explained, right? And that then it's further explained in their eligibility determination notice, as we show you as an example here. And here, like I mentioned before, like we said, some questions that we have here, this is, are very focused around what healthcare.gov looked like in the past. This is an example of how healthcare.gov's notices look as of the last time we saw them. So it will identify what is, that there is a data matching issue. It will award benefits on a temporary basis and provide information about next steps and for how long the individual will be able to get their benefits while it's pending the verification. Healthcare.gov, this is all about what the process looks like on healthcare.gov, and I'm always curious to hear how state-based marketplaces do this. But healthcare.gov does provide some warning notices, so it's not like, okay, that's it, you got it in your eligibility determination notice and that's the end. You will never hear back from us, and if we don't hear from you, too bad, right? That's not how it goes. They do send some warning notices at different time intervals, and they will also send some emails and text message alerts indicating that the individual has to take some action. And at one point, and I'm hoping that this continues to be the case in this open enrollment season and beyond, is that they were also making some outbound phone calls, for better or worse, right? Not all of us love getting telephone calls, and but nonetheless, it's a very helpful way to remind people if that is their preferred mode of communicating, right? Or if it's another way to, sometimes make sure that the person is getting the information. It should warn you that, of course, like we've all experienced in the past, when you get a phone call from an entity that you're not familiar with, and I don't think that the entity's number comes up as saying healthcare.gov. So I mean, that could have changed over the years, but obviously this sometimes people don't answer the phone, or they think that they're being spammed, So there's, it's not perfect, but it is an attempt to try to convince people that they should take action before some bad things happen to their coverage. Sometimes people will send in documents and it will not be sufficient to clear this data matching issue successfully. When that happens, the individuals will get a notice and they will also get a telephone call. And when all of this is said and done and you get to the expiration of your time frame that you're allowed to have to verify your circumstances, if the data matching issue is not resolved, then an individual will get a notice indicating that the DMI is being expired and that something's going to happen, right? In some cases, for example, if you fail to resolve a data matching issue regarding your citizenship, well, that means that you're no longer going to be able to stay enrolled at all in your health plan, right? Because that is a requirement. And in the cases when a data matching issue is resolved, a notice is also sent so that the consumer knows that that has all been resolved. So I'm going to jump in and talk about verification of citizenship and immigration status. And I mentioned a little bit about this in the opening remarks. So basically the way that things work is if an individual is a US citizen, the applicant is going to be, well, all applicants are going to be asked to provide a social security number. For this number will be used for individuals who also are attesting to being US citizens. And when that individual attests to being a US citizen, healthcare.gov will attempt to share that information with the Social Security Administration so that it can try to verify your attestation of citizenship. And oftentimes, the Social Security Administration is able to substantiate that. Most people, this should work successfully. unless something bad is happening, like maybe the system is down or something. Or there are certain times where there are some limitations, and I explained one of them in my earlier remarks, right? For example, a lot of people who are naturalized citizens, or even derived citizens, meaning that, you know, this individual got their citizenship because of their parents' citizenship, right? You know, so maybe they're military parents, they were living in Germany when the baby was born, and then you know, that baby's citizenship was derived. So sometimes it's just limitations. When that happens, the individual will be asked to provide information about their circumstances, and they will be asked to provide some other numbers, and those numbers are they appear within either the naturalization certificate that the individual got or a certificate of citizenship that the individual has. And then those numbers can then healthcare.gov, if the person has them, and by the way, a lot of people will not have those, you know, handy, right? I don't carry those around with me, those kind of numbers, or at least, well, I'm not naturalized citizen, but my sister who is, she doesn't carry that around with her. So sometimes people won't have them. But if they do, healthcare.gov will try to verify citizenship through a data matching system that it has with the Department of Homeland Security. And that system, we often refer to it as SAVE. It's a Systematic Alien Verification for Entitlements program. And sometimes they're able to prove citizenship. So, you know, lots can go wrong in all of this, right? Sometimes people don't provide a social security number, and then there's no way for healthcare.gov to be able to share information with you know, Social Security Administration to see if they can substantiate. Sometimes the number is just mistyped, right? That happens. Other times, the other documents, like I mentioned before in the example of my sister, you know, if she were, you know, to be asked, can you provide me the number that's on your naturalization certificate? She would say, no, I cannot do that. And then she would also have a data matching issue. So sometimes the information that the consumer provides is not close enough, you know, to information in the Social Security Administration or SAVE records because of typos or other data. And then, of course, like I mentioned beforehand, there are times when there are data limitations, and in some cases there are wrong attestations made, and you know, it sounds silly, but the way that the questions are asked, sometimes it's not always super clear to people how to answer them. So I sometimes recommend, you know, you go ahead and check to see if you made the right attestation. And when you have a data matching issue and you have attested to being a citizen, you can send in one of these documents, like a U.S. passport or certificate of citizenship. Excuse me. And these on this sheet are examples of documents that by themselves can prove, you know, can verify citizenship. But many other documents that are provided that people often have, because sometimes they don't have things like a passport, right? When they don't, and they instead have something like a birth certificate that's on the top of the left-hand side of this table. People will have to both provide a document that, you know, is listed here on the left-hand side that really proves citizenship, and a document that's on the right-hand side that is intended to be an identification document, to proof of identification. So those together could then verify citizenship, but not by themselves. So how does the marketplace verify immigration status? So the first thing that will happen is that the individual will be asked if they have an eligible immigration status, and you can see that they have a link to a bunch of different statuses that kind of clarify what they mean by that. It can be kind of confusing, just so that you know. because there's no real perfect way of really listing out every single type of immigration status, because it can get pretty long pretty quickly, especially when you're looking at things like some of the non-immigrant visas, that there's many of them, and people might not really know that they fit within this big giant category of non-immigrant visa holder. So applicants select a document type as well. So if they say, I have an eligible immigration status, the next thing that they'll do is they'll be presented with a list of different document types. And then they will be asked to provide specific numbers from those documents. And then if they do that, then the marketplace will try to verify the status through that connection with the SAVE system that I mentioned beforehand. And, you know, similar to citizenship, all sorts of things could go wrong, right? Like a lot of times it can go right, and that's fantastic. And when it all goes right and SAVE system can successfully verify the information, wonderful. But when it doesn't, you know, there's a variety. It doesn't mean that the person is not telling the truth. It just means that they're going to have to provide some additional information, and in some cases, they're going to have to provide documentation, right? Same kinds of things can happen that we talked about for the citizens in the citizenship example. They might have typos, there might be name changes that occurred, and there are some individuals, some kind of statuses that SAVE will not be able to verify instantly for people. Sometimes for people in this kind of unique set of statuses, SAVE might need a little bit more time. So that can happen as well. And sometimes that means people will initially get one notice saying, hey, you have a data matching issue, you got to provide us some information. And then maybe a few days later, they'll get another notice saying, all good. You know, we have, they'll get another eligibility determination notice. So they never actually say all good. They'll say, here's your eligibility determination notice. And then in that notice, there will no longer be a data matching issue when that has happened. So all super clear, right? Here we have a table, and we have two slides that, because there's a lot of information. But this basically, you know, we're trying to match up here the document type that a person might select, and then what information healthcare.gov is going to ask if you select that as a document type. So I gotta say that it is sometimes super unclear what is meant when these document numbers are asked for, because, you know, there are lots of iterations of different cards, and the numbers are not labeled the same in all of the cards. So we give you an example here, and in the example, we have somebody who has a lawful permanent resident status, and that individual is being asked on the application to provide an, you know, quote unquote alien number. We, you know, don't love using that word at all, but that is the word that's utilized, right? But on the actual card itself, it's going to be labeled as USCIS. So you can imagine that that's not super clear to everybody. So what we did is we have a resource that kind of shows some examples. And healthcare.gov also has a resource, by the way. So, you know, it's not the only place that you can look at, but basically that tries to help a consumer and or you to kind of map this out. So what do they mean when they say card number? Is it labeled SCR, for example? You know, in a very, very long number that doesn't otherwise appear to break up from, you know, like a huge, that's connected to a huge string of other numbers. So it is just complicated. So people really need help with this oftentimes. When, you know, an individual, you know, so basically if they can't have, if a person can't have their immigration status verified electronically, then they will go through a similar process of what we described in the citizenship part, where they will also have to provide some kind of evidence of their immigration status, and they will have that they'll have 90 days, or 95 days to provide that information. And what will happen is that if the individual is not able to verify their status within that time frame, they will get all of those notices. The individual, in the case of losing, when we say that their coverage is terminated, we really mean coverage here. If the data matching issue is because of immigration or citizenship status, it's not just you're just gonna lose your advanced premium tax credits. You're actually gonna lose your health coverage. Now there is a way that if maybe on the 100th day you provide, so you've lost coverage, but on the 100th day, let's say that the evidence that you submitted is now processed successfully and it clears the data matching issue around immigration or citizenship status, there is a special enrollment period that can be accessed based off of when the data matching issue was resolved. So. And if that happens, the consumer has the option of either having the coverage, get reinstated prospectively, so out into the future, or also retroactively to the date of termination. So I'm going to go through as quickly as possible a family example because I'm going a little bit long here. And in this case, we have Roberto and Monica, who are a married couple, and they have 2 children, Miguel and Elena. And Monica was born in Germany and is a derived U.S. citizen. That again means that she got her citizenship as a result of her parents' citizenship. Roberto has been a lawful permanent resident for 7 years, and Miguel and Elena were both born in the U.S. On the application, all family members provide their social security numbers, and Monica, Miguel, and Elena attest to being U.S. citizens, right? So Monica's asked if she's a naturalized or derived citizen, and she says yes. Monica does not have a certificate of citizenship, which is the document number. She's asked to provide a document number from that. So she skips the questions about the request for document numbers. And Roberto, he attests to having an eligible immigration status, and he does provide one of the numbers that he's been requested, but not the other number requested because he only has part of the information. So in this, we're going to look at the data matching results, and let's start with Miguel and Elena. They are able to have a successful match with SSA. And just to be clear, a lot of times children, if they were born in the U.S., it is oftentimes the case that that's going to be a successful data match, and they will be able to move on pretty clearly. It gets more complicated for adults, and part of it is because of some of those data limitations that I talked about earlier. The Social Security Administration has evolved over time, and because of that evolution, they're just more able to substantiate the claims of citizenship, their attestations of citizenship, more for younger people, more successfully than older people. So Monica, there was no successful data match of her citizenship attestation, either with the Social Security Administration or state. And Roberto, his immigration status is not, they don't try to even data match with Social Security Administration because he's not a U.S. citizen. So instead, they go straight to the SAVE system. And in this case, because remember, he only provided a piece of the information, and in some cases, providing that one piece of information is sufficient, in other cases, not sufficient. And we're going to say that in his case, it wasn't sufficient. So there was no match. So what happens? Monica and Roberto are instructed to provide documents to prove their status. And they're given 95 days to do this. Now, when we say 95 days, it's important to remember that we're not saying, so on the 95th day, go ahead and submit your documents to healthcare.gov. That's not going to work, right? Because you need to build in time for healthcare.gov to receive that information and to process that information. In some cases, healthcare.gov might have to say to you, we need more information. So my advice is to not wait until the 95th day, is to try and get this resolved as quickly as possible, right? In this case, all family members are approved to buy marketplace plans, and they're awarded advanced premium tax credits during this 95-day process. So again, like I told you beforehand, you know, on their eligibility determination notice, they will be told that you are eligible to get marketplace coverage. But they will also be told that it is temporary, and that they will have some information in the next steps that indicate you got to provide some documents to prove your immigration or citizenship status, as we indicate here for both Roberto and Monica. Monica, and so we're going to say that Monica and Roberto, they get their warning notices, and their emails explaining that coverage is going to end if sufficient documents are not submitted, and both submit some documents, but they're not sufficient. So in Monica's case, she sends in her consular report of birth abroad. Remember how I said you have to provide 2 pieces of documents for a lot of the citizenship documentation pieces, and this is an example. She would also have to provide a second piece of information or another document that also verifies her identity. And she only provided 1 piece of it. So she's out of luck, right? Not going to be sufficient. And in Roberto's case, he submits his foreign passport, and in some cases that is going to be sufficient. Well, first of all, it's important for you to know that that is going to be something that's listed as a potential thing that you could submit, and for some lawful permanent residents like Roberto, that is going to be sufficient. There'll be enough information on that passport to do what it needs to do, but in other cases it's not. And we'll say that in his case it wasn't, so he needs to provide something different. So next, you know, they get another notice, and Roberto sends in a copy of his green card. And based off of that, that's going to go ahead and clarify and clear his data matching issue. Monica does not have documents from the list of options to prove her identity. So what ends up happening is she ends up actually getting a data matching expiration notice explaining that her coverage will end because she did not provide enough proof of her citizenship, enough documents to prove her citizenship. So Monica can still regain coverage if she sends the necessary documents. And then after resolving a DMI, she can even re-enroll in Marketplace plan prospectively or retroactively with a special enrollment period. And we kind of lay that out here. I'm not going to go into the details in the interest of time. And we are going to say in this example, actually, I guess I will go a little bit into detail, is that, you know, sometimes what's going to be tricky is that people need to take a step like going and getting, like, maybe not everybody has a driver's license, right? But maybe in this case, she had to actually go and get that other piece of documentation before then she can actually successfully clear this. That's a tall order for a lot of people, right? That, especially these days, right? I think you have to get like appointments. It's not easy to be able to get some of these documents covered. So it's going to be even trickier this year than past years. This is one of the reasons why I think it's super important that people begin, like, even though they hear 95 days and they think, oh, it's a long time, but that goes by really quickly, especially when there's all sorts of barriers to being able to get documents. Now I'm going to turn it over to Tara, who will talk. Oh, I don't know if we're pausing for a question or two before that.
Nope, I think we're going to plow ahead.
Okay, good. So then to Tara.
Thank you, Shelby. So we're going to talk next about verification of household income, and I've been answering as many of your questions as I can in the Q&A function because I know we're sort of pressed on time, and we really try to respect your time. I know you're very busy, so we're going to try to make this in an hour. All right, sorry about that. So applicants will attest to their projected income for 2021. The applicants have to enter the source and the amount of their income for everyone in the household, even if only some family members are applying for coverage. The exception there that gets a little confusing is that if you have a dependent, only enter their, and they have some income, only enter their income if they have a tax filing requirement. And after the tax law from 2017, this is a pretty rare circumstance for someone to be a dependent and to have a tax filing requirements, because their income would have to be quite high for that to happen. But we do have a resource available to help consumers understand where those limits are. And then, as Shelby explained at the beginning, the attestations on the application are matched with the data in the federal data hub. There might be many reasons that the data hub can't verify income, and I'm going to flag for you that this might be even more true this year, because we will be looking at the data hub will have tax data from 2019. And that might be dramatically different for some families than their 2021 projections because of the impact of COVID and the economic crisis. Especially if you look at some of these reasons that the data matching may not verify income. Change in job or hours of employment, many people certainly are affected by that. Changes in household, retirement, irregular freelance income. Also one-time income. I keep flagging for folks. Remember that when someone leaves a job, sometimes if they have just a little bit of money saved in like a retirement plan, sometimes that will be just cashed out from the employer, and the employer will just send a check, and someone has no idea why they got that check. But what they don't know is it's taxable income. Or it could be that there's no tax data available because someone didn't file taxes in a prior year. In general, the attestation could be accepted, and even if the attestation varies from what's in the data hub, it can be accepted if the attestation is higher than the income in the data hub, regardless of the income difference. So if the data hub says your income was $20,000 and your projection is $30,000, that's good. They'll take it. Or if the attestation is lower, but it's not low enough to trigger the threshold. So what's the threshold? The threshold is a difference of 25% and $6,000 lower than the data available in the hub. So those are the two numbers to keep in mind, 25% and $6,000. So that means if you have a little bit of a variance, that's okay. It's not all going to trigger a DMI, but if the variance gets bigger, then that's when the DMI is triggered. And in that case, the applicant's awarded subsidies based on their attestation, but they have to provide documents. And as we said before, they have to provide documents when there's no income information in the data hub, the attestation exceeds that threshold, being lower than the data available in the income hub or in the data hub. So if someone has income in the data hub that says that they earned $40,000, but they're projecting income of $25,000, that's when a DMI will be triggered. And you can think about it and remember the direction of these numbers in this way. This is really, in many ways, a fraud protection provision. So they don't want people to, on the sly, underestimate their income and get big subsidies. They also don't want people to have to repay at the end of the year if they have made a projection that's too low. So you can think of it either as a bit of a carrot or a stick. And also the attestation, someone will be asked to verify if their attestation is above the poverty line, but data sources suggest that income is below the poverty line. And a little more on that, because this is new as of 2019. An income DMI is triggered if the applicant attests to projected income that's between 100 and 400%, and they meet all the other tests for APTC. But the data hub indicates their income is below the poverty line, and their attested projection is more than a reasonable threshold higher. So if someone has income that's at 90% of the poverty line, according to the Data Hub, and they're estimating that their income is 130% of FPL. That might trigger a data matching inconsistency. And who this really affects is the lowest income folks in states that have not expanded Medicaid, because those are the folks who are on the cusp of this 100% line. It does not apply to non-citizens who are lawfully present and eligible for Medicaid below 100% of the FPL. So here's an example of this. Walt lives in a state that hasn't expanded Medicaid. He works part-time, and his earnings were about 90% of the poverty line. And so this makes him ineligible for both APTC and ineligible for Medicaid in his state. But if he gets a raise and his income is now above the poverty line at 132% of FPL, there's still no DMI, income DMI triggered, because the variance is not large enough. His projected income exceeds his prior income by more than 25%, but it's less than a $6,000 variance. Now, if we change the facts and say that he had lower income in 2019, then it might be that the variance is too great and that the DMI is triggered. We don't intend to read this to you or to have you read it right now, but there is a very long list of documents that can be used to prove income, depending on the source of income. And healthcare.gov actually has a pretty comprehensive list of that. And I believe we have that linked in one of our resources. I will just note, because it's a change, is that if you're submitting the 1040, the most recent 1040 as evidence of something, one, note that it's not always great evidence, because that often goes too much to proving the past rather than proving the future projection. But if you do find the 1040 useful, you also have to submit the new Schedule 1, which has adjustments to income. So just hot tip. Healthcare.gov also has these handy little guides for detailing the kind of income that someone has and the amount of their income, and coming up with a total household income. So you can see that we have the link there, and when we send out the slides, you'll be able to check that out. And they have that for both a total income and also self-employment. So let's go back to Walt. So his projected income triggers a DMI, and what happens to Walt now? Well, he can still enroll in coverage. He can still get APTC and CSRs according to his attested income, but he'll be asked to submit documents to prove that income within 90 days. And to prove his new income, there are a variety of things he can submit. He can submit a letter from his employer that shows his increase in wages and hours. He can also submit a pay stub or a check or a copy of a check that's paid to him as wages and shows the pay raise and the increased hours once he gets the raise. So it really depends on the timing of his DMI. Like Shelby said, you don't necessarily want to wait until day 90 to start this process. But if he does wait until after January 1st, he gets paid the first time, that's one more piece of evidence that he could use to justify his new estimated income. And so that's what Walt does. He submits a pay stub with his higher hourly wage, and he explains his new hours and his expected annual projection. And so his DMI is resolved. Sometimes documents just aren't available. In those cases, when the income is expected to change and proof isn't available, you might be able to submit a signed statement. This statement should include the household information and an explanation of the income projection. And so you can see we have a little sample here. This is a person whose projected annual income for 2021 is $21,000, and she just puts down a few sentences to say, this is how I got to the $21,000. And often this will be sufficient. Let's look at an example of someone who has a pretty significant change in income and what happens to this family. We've got Jalen, who is self-employed, and Mia, who works part-time at a bookstore. And they're married and they're filing jointly with and claiming their 2 kids. So on the family's 2019 tax return, Jalen had $50,000 in self-employment income, and Mia had $25,000 from her job for a total of $75,000. But as happened with many people, Jalen has an income decrease. And so he expects that his income from self-employment will be cut in half in 2021. Because of the loss of income, they also expect to withdraw $5,000 from an IRA. When applying for 2021 coverage, the family is going to attest to this new amount. And the attestation is going to be more than 25% and $6,000 below what their 2019 tax return shows. And so that's going to trigger a DMI. So they've got the DMI. The marketplace still gives them APTC based on the attestation, gives them 90 days. If they fail to submit documentation, the marketplace is going to use that old higher income as the basis for determining their APTC. So their APTC will be lower than it otherwise would be if they would justify their new projected income. There are a number of documents that the family could submit. They could submit a ledger showing projected business income and expenses, and that makes it sound very complicated and official, but I think that the marketplace is fairly flexible about this, or at least they should be, because we know many people who have who are quote self-employed don't really consider themselves self-employed and don't have great records. So in many cases, you have to sort of create a record for them. But you can do that in what we would call a ledger. You would also submit Mia's most recent pay stub, assuming it's representative of what she would earn in 2021. And the tendency here is that you know that the problem here is Jalen's projected income, because that's what's changed. But remember that you're not just verifying Jalen's income, you're verifying the entire household's income. So don't forget to put in Mia's recent pay stub. You can also include a statement that just sort of summarizes all of these things that are happening and all these shifts in income, including the fact that they'll take money out of the IRA. So we've done a little ledger of our own with the math there. If DMIs are not resolved, a consumer can request additional time beyond the 90 days by calling the marketplace call center and showing that they've made a good faith effort to obtain the required documentation. So this might be particularly important this year because we know that many people may have situations where their employer is not open right now. It may be hard to get, but they expect to go back to work. So it may be hard to get some verification from an employer, for example. Also, if information is available in the data hub, as happened in the last, or as we raised in the last example, the APTC will be changed based on that information. And so in that last example, if Jalen and Mia didn't submit information, their APTC would be based on an income of $75,000 instead of $50,000. And if available information shows income under the poverty line or over 400% of the poverty line, of course, you're not eligible for subsidies. Unless you meet the exception for a lawfully present immigrant who doesn't qualify for Medicaid based on immigration status. If income information is not available in the data hub, the APTC is terminated altogether. If the subsidies are reduced or terminated, the enrollee remains enrolled and is responsible for the higher share for a higher share or the entire premium. And so just note for people that just because their subsidies have changed, it doesn't mean that they are dropped from their plan right now. They'll be billed for the new premium amount, which might be withdrawn from their bank account if they've authorized automatic payments. So we know that that can be a hardship for some people. And of course, if they don't pay the full premium, the grace period begins. Enrollees can restore the APTC by submitting documentation, sometimes by correcting the projection in the application. If you get to a point where you're trying to cobble together different sources of income, and then you realize, ooh, maybe that projection wasn't quite right, then you can go back into the application and fix the projection and try to clear the DMI that way. You can also file an appeal, and if your appeal is successful, you can get retroactive APTC. If there's no appeal, or if the appeal is unsuccessful, PTC for the gap months could be available on the tax return, but the person would have to remain enrolled in the marketplace plan and pay the premium for those months, which we know, again, can be a hardship for people. So a quick example of John. John has never filed taxes, so we know that's going to be a problem because the Data Hub has no information about him. He has an annual income of $22,000. Well, we're being kind to John and saying that he moved and never got the reminder notices to submit documentation. It could be that John just didn't pay attention to his notices. But his APTC and CSR were terminated after 90 days, and that got his attention. So what can John do? He can submit documents now. If he verifies his income, he can restore his APTC. He can appeal, and he could get APTC retroactively or prospectively. Or he could stay in his plan. He could say, I'm just going to swallow the full premium, and then I'll take the money in a lump sum on my tax return. But if he opts to do that and then he fails to pay the premium and his coverage lapses, that won't generate an SEP, and so he may have to wait for the next open enrollment period, or for any other special enrollment period that he qualifies for. So quickly about verification of MEC, because we've gotten some questions about it in the Q&A. There is an electronic match with Medicaid agencies, Medicare, OPM, which is the Federal Employment Database, and databases for employer-sponsored coverage that may show that the applicant is enrolled in other MEC. And so in some cases, people are asked to verify that they are not enrolled in coverage. So this can be tough because it's really hard to prove the negative. But if not resolved in 90 days, the consumer could lose eligibility for APTC. There's also the concept of periodic data matching. So what we just talked about was with the DMI is what happens at the beginning of the process when you're applying for coverage. But there's a process called periodic data matching, PDM, which happens during the year. And this is a periodic check throughout the year of enrollment, date of marketplace enrollment against enrollment in Medicaid, CHIP, or Medicare. If the person's found to be enrolled in public coverage and coverage with an APTC, they're going to receive one of these PDM notices and only have 30 days to respond. So you've got to act quickly on this one. It gets a little bit complicated. If someone is enrolled, if someone is enrolled in Medicaid or CHIP and also concurrently enrolled in getting APTCs, they're asked to end their marketplace coverage. Or if they're not enrolled in Medicaid CHIP, they're asked to update their marketplace application. And this is all spelled out on the notices. And if the consumer does nothing, the APTC will be terminated. But remember, just like with DMIs, the plan stays in effect at full cost. And so a person could be burdened with the premium, even if they let the grace period expire. Remember that they'll still have that first month's premium that they'll be on the hook for. And a Medicare PDM notice will either terminate APTC or it will terminate both the QHP, the Qualified Health Plan, and APTC if the person elected to do so on their application. So people are allowed to elect if they want that to happen. And if the QHP is terminated, other members of the family get an SEP to re-enroll in coverage. And turning this back to Shelby.
Hi. Okay, I'm going to go through this pretty quickly, and I just want to make sure that I cover a couple of things on identity proofing. And one of those things is that oftentimes people get confused with what's happening, right? Why is this individual being asked to provide, information about their citizenship status, for example, they think, right? Because when a person goes through identity proofing, and isn't successfully able to do that online, they are also asked to provide evidence that looks very similar to the evidence that they're being asked to provide when they're trying to verify their citizenship status, for example. So a lot of times, consumers and people who are helping consumers apply, it's not super clear to them what's going on, right? So identity proofing is not satisfying an eligibility requirement. It's not verifying an eligibility requirement. What it's intended to do, it's intended to provide a secure process or interface with a consumer with a government data system that is touching on other government data systems to, electronically verify circumstances. So what happens when an individual is not able to successfully clear this upfront, because this is what happens very early on in the application process. The individual provides some information. That information is then shared with the third party kind of credit bureau type agency, and then they're presented a bunch of questions to ask. And if you can't make it through those kind of credit related questions, or you don't have enough of a credit history, so you don't even get presented questions, regardless of whether or not you're in a situation where you can't answer the questions or you don't get questions to begin with, the individual is asked to provide evidence to prove their identity. And it's not always super clear to the individual that that's the reason, that's happening. And it's also not super clear to the individual what the limitations are as a result of not being able to clear that hurdle in the application. And what the result of not clearing that hurdle includes things like, you have an application, yes, you can provide information into the application, but you can't finish the application online. You have to actually, but if you do not have a application that has been identity proofed, you then would have to pick up the phone and call healthcare.gov to actually submit the application. You also can't select a plan online, and selecting a plan over the telephone with the marketplace, when there's so many different, choices, that's hard. You can't really report changes on the application. And I think that I've heard enough people complain about other verification issues that I really suspect that in some cases, you really have some limitations to being able to verify your situation electronically without picking up the phone and calling the marketplace to provide information that could clear a data matching issue, so that the marketplace would be able to be that interface with the other electronic data sharing. So when that happens, there's a bunch of things that could happen. Some people, like I said, are presented the questions and they're not able to answer them. Other people, when that's the case, they might be instructed to call 1-800-ish, 188 number. I don't, one of these telephone numbers where they're going to interface with Experian, and in some cases, they can answer some questions that are provided by Experian, and they can clear it that way. Other people have to provide some documents, and in the meantime, it is important to note that you can go on, like I mentioned beforehand, for a variety of reasons. You can also go straight to healthcare.gov call center, and you can also submit the application that way. Remember how I said that the kind of evidence that people are going to be asked to provide looks very similar to the types of evidence that they're asked to provide if they're trying to prove citizenship. So again, this can be very confusing to people, but again, it's helpful if somebody can clear this step in the process so that they are able to have a full functioning application where they have more opportunity to do things like selecting a plan without having to take all these other extra steps that we have listed here. I'm going to fly through these tips because we've touched on so many of them already in the application. In some cases, you all have asked some good questions like, hey, or you've in the questions and answers, you've indicated, by the way, there's a functionality in the application where an individual who maybe, you know, if the name that they're providing on the application looks different than what's on their card, maybe they got married and have a new name or something like that, there is the availability of this option to provide the name as it appears on the document, and that sometimes clears the data matching issue. So anyway, we have some tips here for people who are uploading documents, which is the fastest way, much faster than mail, to submit data, documents that prove their status and or income. Here's just some general, you know, tips that healthcare.gov has provided that will make that whole process work for an individual. So making sure that they're the right kind of data file and not, you know, exceeding the size of you know, that would be acceptable by the marketplace. And, you know, so we provided some resources here as well. We really recommend you taking a look at them because this is tough. It can be very, very difficult to get through the data matching issues. And I'm going to turn it back over to Ina, and thank you all for being patient with us, and sorry that I took so long up front.
Thank you so much, Shelby and Tara. Really appreciate all of that. As a reminder, we'll be distributing the materials from today's session via email, and we'll post everything to the Beyond the Basics website. The next part of this webinar series will cover health insurance plan design. It's scheduled for this Thursday, October 1st at 2 p.m. Eastern, 11 a.m. Pacific. You can register for upcoming webinars on the Beyond the Basics website under upcoming webinars. And if you have questions or need assistance, please email our Beyond the Basics contact email at beyondthebasics@cbpp.org. And with that, we'll bring today's webinar to a close. Thank you again for joining us today.